So which tests may be recommended for brain death determination as an ancillary test? These are two types. We would have tests for cerebral blood flow, where we would confirm by imaging that there is no cerebral blood flow inside the brain and hence the patient is brain dead. And the second set of tests are the tests for electrical activity or neurophysiological tests, where we see that the patient does not have any kind of electrical activity in the brain. And these tests are synonymous to the ECG for the heart. So like we have a flat ECG in a patient with a cardiac death, we would have a flat EEG in patient where there is no electrical activity in the brain. Let us go to these tests one by one. Before that, I would like to reiterate that the ancillary tests which are validated actually are just 4. These are the 4-vessel angiography, SPECT and TCD in the tests for cerebral blood flow imaging, and EEG in the tests for electrical activity. So let us go on to these one by one. First of all, discussing the tests for cerebral blood flow. Digital subtraction angiography or 4-vessel angiography has historically been considered the gold standard for ancillary imaging test. Now what we do is the catheter for the DSA is placed in the aortic arch and we inject contrast under high pressure so that it reaches both anterior as well as posterior circulation. That is, we have to visualize both the left and right common carotids and both the left and right vertebral arteries. The criteria for brain death is absence of any perfusion. Now, absence of any perfusion would mean there is no intracerebral filling of carotid or vertebral arteries at the level of entry into the skull. There is a patent external circulation, carotid circulation that is present, and there is a delayed filling of superior sagittal sinus. This is an example of a 41-year-old female patient who was brought to the ED with a massive ICH. After adequate resuscitation, it was found that this patient does not have any brainstem reflexes and the apnea test was also positive. Now, this was the 4-vessel angiography that was done in this patient. We see there is a patent carotid circulation. The external vessels are visualized, but there is no intracerebral filling. And this is demonstrated in both anterior as well as posterior circulation. Now, this is the gold standard, but the gold standard also has certain limitations. Now, what are the limitations of digital subtraction angiography in brain death determination? First of all, the foremost is it is an invasive procedure. So we need to put a catheter into the femoral artery in order to cannulate the aortic arch and inject the contrast through it so as to visualize the circulation. So it is an invasive procedure. It requires an expert operator to perform. Obviously, we need an interventional radiologist to perform a DSA. It is expensive and the patient needs to be transferred to the angio suite. That is again a very, very major issue in transporting unstable patients to the angiography suite from the ICU. Also, the contrast that we may be injecting may be nephrotoxic. Other issues that may arise in DSA are stasis filling. Now, stasis filling is due to diffusion of contrast in static column of blood, and this may result in false negatives. So, stasis filling is a big issue in ancillary imaging for cerebral blood flow. Again, the patient may have undergone a decompressive procedure, and because of the decompressive procedure, the patient's ICP might be low and there might not be a circulatory arrest that has occurred in the brain. So a residual cerebral circulation may be seen, which may result in false negatives. The next test that we come on is the radionuclide scintigraphy. Now, what is done in radionuclide scintigraphy is there is a gamma emitting radioactive tracer that is injected intravenously. Now, usually the radioactive tracer that is used is a brain-specific lipophilic radioactive tracer, and that is technetium-99 HMPOW, that is hexamethyl propylene amino oxidase. This tracer crosses the blood-brain barrier and accumulates proportional to the blood flow in the normal gray matter, that is the cerebrum, the cerebellum, and the brainstem. Now, the thing that we need to take care of, that the isotope or the tracer that we are injecting should be reconstituted within 30 minutes of injection. And images are taken immediately after IV injection, after 30 minutes, and after 2 hours finally. The tomographic processing of lipophilic compounds is commonly known as single photon emission computed tomography or SPECT, and this is used as a reference standard. Now, this is how it looks like. FEC, there is no accumulation of tracer in the brain due to absent blood flow in these patients. Now, this is called a hollow skull. This is a hollow skull or an empty bulb sign, characteristic of brain death.